I'd like to go straight to the topic about biosensors, elderly, and healthcare. So elderly and global health, why do we care? Well, there are 4 challenges or realities that we need to face in the coming years in this area of global health. The elderly. The elderly population is increasing and will continue to increase. By 2030, there's 1 billion elderly population in the world. By 2050, there will be 2 billion people. In many developed countries, there are more elderly now than the 12 to 24-year group. By 2050, globally, there will be more elderly population than the equivalent 12 to 24 years old age group. So what's the implication of this? The elderly population will continue to be in the workforce. They will continue to be independent, and most of them living at home. They will be at a higher proportion than the 12 to 24-year-old workforce, or higher workforce, higher age workforce. But unfortunately, they are vulnerable to infections because they have reduced immune system due to aging. They have chronic diseases, and therefore they need more medical and social services. Healthcare cost is continuously rising, now and in the future. In the United States alone, 1% of the healthcare spenders constitute 20% of healthcare spending. And the top 1% is 2/3 of them are elderly. The elderly spend about $90,000 per year. That's the top 1%, whereas the bottom 50% spend only $236 per year. There's this less access to healthcare. In many parts of the world, healthcare is a luxury. There are more people who are on the periphery of medical care that could lead to deaths and disabilities, which could have been prevented because they don't have access to healthcare. Then there's the limited resources. There's just not enough money to build hospitals and hospital beds around the world. And what's happening? There will be more people cramped in small spaces, and there are less medical professionals than patients in terms of ratio. This kind of conditions can transmit diseases, and sanitation can be compromised. There are 3 real-world problems or examples that I would present this afternoon: tuberculosis, diarrhea, and malaria. The combined fatality from these 3 diseases are millions of people. Tuberculosis kills 1.7 million people every year. That translates to 3 deaths per minute. So as we speak, there are people dying of tuberculosis. And before I end my presentation, there will be about 60 people who will be dead from tuberculosis. There's 2 billion people infected throughout the world. 9 million cases every year. And this disease is highly infectious. Research shows that an infected person infects 6 others before that person gets treatment. And this disease orphans 10 million children a year. TB and HIV is a bad combination. It's a fatal combination. And then you couple it with drug-resistant TB. Moderately drug-resistant, extensively drug-resistant, and totally drug-resistant. TB is treated 6 to 9 months. The regular TB, the ordinary TB. Drug-resistant TB, moderately drug-resistant TB takes 2 years to treat. The extensively drug-resistant TB takes more years and more therapy. What's the implication? It becomes expensive and draining to the patient and to the caregiver. The diarrhea is due to cholera, E. coli, salmonella, norovirus, rotavirus, whatever you name it, through food, contaminated food and water. The combination of this, the young and the elderly are at risk. There's about 2.6 million deaths in 2009 from the combination just of diarrhea. 1.5 are children aged below 5, and 1.1 million are older. Then we have malaria. Malaria is caused by Plasmodium falciparum, and it's transmitted through mosquitoes, mosquito bites. In this area, it is based on the tropical and subtropical regions, and there's about 3.3 billion at risk of malaria. So I invite you to the world of tricorders. You know the Star Trek movie? This tricorder, this is a replica of a tricorder. It's used to scan diseases. In the Star Trek, they scan this, and you will see all the information about the patient. Disease status, severity, blood analysis, and so on. Data analytics is in there. Data transmission is in there. Everything is in there. So this kind of world is not actually very far from reality. I welcome you to the world of biosensors. The one on the left is our biosensor that we're developing in the lab. The one on the right is your typical glucose meter. A glucose meter is a successful biosensor in the market. What does it do? It's small. You're empowered to screen yourself. It is inexpensive, simple to use, and you can put it in your pocket. So biosensors are designed to be rapid, inexpensive, simple, and early. How rapid? We're talking about minutes or seconds for a biosensor, where the traditional method is for about three days or weeks. How inexpensive? Biosensors, we're talking about pennies or less than $1 at least. Current diagnostics, $35, $100, sometimes they're like $2,000. Simple. You and I can use it anywhere, anytime. Whereas the current diagnosis, you have to send it to the lab with specialized personnel. Because it is rapid, inexpensive, and simple, you can actually use it for early detection, early screening, and frequent screening. In our lab, we look at nanobiosensors. Nano being, we use nanomaterials, nanotechnology, nanoparticles as our transducers for making these small devices. We use it for pathogen detection as well as biomarker discovery. So, what is our hope? That through early, rapid, inexpensive, simple, and early detection of these diseases, we can say goodbye to tuberculosis, goodbye to diarrhea, and eventually say goodbye to malaria. Our heart's desire in our lab and in our research is to eventually have our elderly healthy, happy, and a right place in society. That's my take for this. I want you to take this message for this afternoon. Thank you, and thanks for you listening.